Hello everyone, it's Dr. Dave. Hopefully you're all doing well, having a nice week. Looking forward to the coming weekend. Coming at you today on behalf of the Toronto Neck and Back Pain Clinic with your daily health update for Thursday, March the 11th, 2021. Going to share with you 6 areas of health and wellness, news and information to help boost your own health and wellness efforts today and throughout the week. Somewhere around this video you can read through all 6 of those areas, and if you'd like a copy, DM us on social, send us an email here at the clinic, or even give us a call and we'll make sure we get that to you. Not going to treat, diagnose, prevent, or cure any illness or disease with our time together today. However, you just never know what great things can happen to support those experiences you're trying to create every day that are positive, fun, and rewarding when you're nice and healthy. And when you focus on a little bit of health information every day, it can turn into a lot of health advantage over time. So good on you for being here. Couple areas we'll just touch on briefly. The Acta Diabetologica report, February 2021, talks about blood vessel issues that are common in diabetics. So if you or someone you know either has or is at risk of diabetes, then especially type 2 onset, adult onset as they used to call it, diabetes, then you may want to look into that. And then as well, for the gentlemen out there or the women looking after their gentlemen, or otherwise whatever couples out there looking after each other, of course, there are ways to reduce your prostate cancer risk that are good to know. The Mayo Clinic came out with that February 2021, and you want to talk to your doctor about those risks and what you can do. But guess what? Like so many other things we talk about on the daily health update, it comes down to those lifestyle choices. So stay on top of those lifestyle factors if you can. One of the things you can do, of course, is keep refining your nutritional approach, your diet. According to the Journal of Nutrition, Health and Aging, March 2021, there might be some benefits from drinking tea when it comes to depression. The compounds found in tea have been linked to several health benefits, and a new study reports that tea drinking may also protect one's mental health. The study followed over 3,000 older adults for 4 years, and it revealed an association between drinking 3 or more cups of tea a day with not only a reduced risk for developing depression, but also lowering a risk of worsening symptoms among those who began the study with depression. So instead of reaching for other things that we commonly do when we're not feeling well, even with our mood, you may want to try some tea. And then when you're done with your tea, if it's appropriate, you may want to go for a swim. This from Swim England, February 2021. They say no matter your age or fitness level, swimming is a great form of exercise. Health experts note that swimming offers a full body workout, is great for welling, helps reduce stress, burns calories, lowers the risk of many diseases, increases energy levels, and allows you to exercise without sweating, or at least being drenched in that sweat, because you're drenched in water, I suppose. But swimming now, that here in the northern and western hemisphere, we're heading into spring. Hopefully eventually some outdoor swimming available, which might be, I don't know, maybe a bit safer than indoor swimming, although most places where you swim with a pool are pretty big, so generally maybe pretty safe, especially with physical distancing. Maybe some lane swimming would be good soon as things open up again, but it really is a good form of activity that engages your body in many different ways, and 360 degrees of resistance with those movements. So swimming definitely is beneficial, and if you enjoy it, is better than working out. You can go and do it and have some fun while you're doing it, hopefully. And when you're done swimming, you may want to do some singing, or you could try singing while you're swimming, at least in your head, but maybe not in a choir. That might be tough unless you're doing some kind of synchronized swimming, in which case you could have a singing choir that does synchronized swimming. But anyway, I digress badly. The PLOS One journal, February 2021, talks about singing in a choir that offers benefits to seniors or the elderly. Older adults with a decade or more of history of singing in a choir not only reported a greater sense of social togetherness with their peers who are not part of such a group, but they also appeared to be more satisfied with their overall health. So these kinds of social activities, even though not necessarily the same as a physical activity, are also very good for us in many ways, especially for our mental health and wellness. So whether you're an okay singer or a great singer, and maybe you don't even need to be a good singer, you might enjoy just singing, and there's a choir out there for you, I'm sure, or some other singing opportunity. You should definitely look into it and engage. Feed your soul, if you will. And finally, from the Saudi Medical Journal, January 2021, they look at the benefits of manual therapy for neck pain sufferers, something that's well documented in the research and literature, and something that manual practitioners like osteopaths, chiropractors, massage therapists, some physiotherapists and athletic therapists, depending on what they do and how they do it, may help you with. Non-specific neck pain patients treated with mobilization therapy, a type of manual therapy provided by many different practitioners, including chiropractors, for twice a week for 3 weeks, experienced improvements in pain, disability, and well-being. So it can happen, but of course it depends on the type and nature of that neck pain, which needs to be assessed properly first so it can be matched with appropriate form of treatment, sometimes more than one treatment or type of treatment, as well as the appropriate self-care and behavior modification. What you do every day may be feeding into that neck pain, and if we can show you other ways and options to get through your day without feeding into those problems, that can also support some progress. So whether you're drinking some tea today, maybe trying to get out and do some swimming in your area if it's available, and maybe doing some singing, then good for you. But if you're doing it with neck pain, go get that checked as well. That's kind of how we summarize today's daily health update. Tomorrow, Friday, end of the week, I hope you enjoy, and we'll send you a written format tomorrow to look through, and then Monday, after we all hopefully rest and do something fun for ourselves on the weekend, we'll catch up with you again with another video. Thanks for supporting us. Thanks for showing up. Thanks for sharing this with people that might need it or benefit from it. The more often you tap in, tune in, and turn on some good health and wellness information, the more likely it is to help support those healthy outcomes you're looking for. So keep up the good work, enjoy yourselves, and I'll see you next time. All the best.